My name is Mark Katumila. I work at Kilifi County at Marakani Hospital and I'm a midwife. I practice as a midwife, and at the same time I advocate for quality midwifery care or quality sexual and reproductive health care for young mothers and all women of reproductive age. It's diverse. We have different women with different experiences. There are some who come into hands of qualified midwives or qualified professionals who give them quality care. And there are also some who come into hands of those who are not competent. And again, as much as there is a qualification and professionalism, when we talk of VCAT, actually it has been the best session ever because we realize that most of these healthcare providers really need this because most of women who come into our hands really need our help. And when we have the value clarification and attitude change, actually we give the best, we give the quality services to these women, and by the end of service provision, at least they feel they were in the best hands, and the services which were provided to them were to the optimum. The four categories you've mentioned have several concerns, and you find that most of the facilities are not friendly to them. For example, when you talk of the disabled, the young women with disabilities, you realize that most of the facilities are not even disability friendly when it comes to landscaping and all that. When it comes to even service provision, you find out that for this disabled, taking that as an example, this person needs a clean, comfortable wheelchair. This person needs to be given priority. This person doesn't need a long waiting. This person needs to be given optimum care. Because at the same time, as we give these people care, we need to give them quality so that they don't keep coming to the facility unnecessarily. So when we strive to give them the best care, we even minimize their time of coming to the hospitals. So the concerns, one is about the facility setup. Number two, it is about the staffs. Yes, we might be having adequate staffs. Of course, we don't have adequate staffs, but even in an instance where we have the adequate staffs, do they have the right knowledge to deal with these groups? Because these groups, yes, they feel disadvantaged. So when they come to us, it's us to have the appropriate knowledge to see how we can sort them the best. So about infrastructure and about the staffs and about the right skills, right training to give these people the best. And again, also the facilities. At least anytime they come to the hospital, there should be those facilities which are friendly to these people, the persons and the staffs who are friendly to these people. In most cases, most of the healthcare workers, I will say, we are not well much conversant with the law. So you find out that we just give services based on what we learned in school, but we don't really know what the law entails in relation to service provision to that particular client or staff. You realize that most of the time we give the services, yes, but we don't give it optimally. Sometimes we give services with a lot of fear. We give services with some gaps. This is because, one, we don't have maybe the right skills or trainings, and two, we don't even know what the law says about that particular service. And that already gives a gap because you don't even know when you provide that service, how safe will you be on the legal perspective. So it is good enough for all the staffs who provide services, especially to the four categories, they should be well conversant with the law so that you know where, to what limit, to what, how far you can stretch when providing the services, and how safe you are on legal matters.
So it promotes access to comprehensive HIV prevention services, including access to information, counseling, testing, and treatment. So this is another law that guides us in our practice when people want PEP or PrEP this is the law that anchors that. And it prohibits discrimination. So we are back to values against people living with HIV and AIDS.
What we got from the session was really brilliant, and we didn't even expect. We are going back with this legal perspective on what, in relation to what we are giving on the services to these people. We commit. Personally, I commit to providing the best quality SRH services to these 4 marginalized group, and even to every young woman, every woman of reproductive age, to the best with regard to and within the perspectives of the law.